We're going to see states start to reevaluate the folks that have been on Medicaid and throughout the pandemic and couldn't be kicked off. And now they're going to start looking at income and other eligibility requirements. So we're going to hear a lot about what happens to some of those folks. There's an expected, several million people may lose their coverage. Most people with insurance are going to continue to get their shots, their vaccines covered without a copay. There will be differences based on the kind of insurance you have. And then with treatments and those at-home test kits, that's also going to vary depending what kind of insurance you have. But some people are going to have to start paying either a copay or the full price of those at-home tests or the treatments. In light of a lot of these specialty drugs, it's not just the weight loss drugs, right? We've got a lot of fabulous new products that are very, very expensive and people are using them. And so employers are trying to figure out, what do we do about this? Many hospitals have not fully complied and haven't posted all of their negotiated prices with all of their insurers and or their cash prices. They might still have their charges up there, which, as we know, are kind of like the list price that people don't necessarily pay. So hospitals still kind of a mixed bag. The insurers have released a lot of data. And in fact, they've released so much data that even researchers with great big giant computers are having a hard time downloading it and synthesizing it. I think the thought was that entrepreneurs and researchers would be able to take this data, put it together, and then you and I could go on some handy website and say, yeah, you know what, I got to get an MRI of my knee, and then I'm probably going to have knee surgery after that. So how much might that cost me? And you'd be able to find out ahead of time. That's not really how it's working out right now.
A lot of people think it's going to be a tough year to get any big reforms through Congress because of the divided government. So one of the things that I'm watching really closely is all these different healthcare funding reauthorizations and what, if anything, rides along with those, because it seems like those are pretty much must-pass legislation pieces. So that's PAPA, the Pandemic and All Hazards Preparedness Act. The Support Act needs reauthorization this year. There's a delay of Medicaid dish cuts from the Affordable Care Act, community health center funding. Those are sort of the four big buckets. Looming over everything is the debt ceiling discussion and whether there will have to be any cuts to or reforms to entitlement programs, specifically Medicare and Medicaid because of that. And that's a big debate. What counts as a reform? What counts as a cut? Pharmaceutical companies have argued that drug negotiation, price negotiation will stifle innovation and make sort of create disincentives for companies to continue to create and invent new pharmaceuticals. I think there's also been some evidence that won't happen. We haven't rolled this out yet, so we don't know for sure. Definitely companies are sounding the alarm about it. I think that COVID has completely changed the way that our healthcare system operates in a lot of ways. Telehealth is already a lasting impact. I've heard all the metaphors you could think of. You can't put the toothpaste back in the tube. You can't put the horse back in the barn. It goes on and on. But I don't think that consumers are going to give up using telehealth. And I don't think that providers want to lose that flexibility either. And Congress has already extended it for 2 years after the end of the public health emergency. I think a lot of these programs that have healthcare programs that have funding from the federal government that are, relatively bipartisan and uncontroversial and have been seen to help patients and providers are, when their funding is up, it's not that much of a question if Congress is going to reauthorize their funding. More, it's a question of, are they going to increase their funding, and do they make any changes to the programs or add any other small policies to the package that's reauthorizing the funding? So a big one that I'm looking at is the PAPA bill, Pandemic and All Hazards Preparedness Act. This is the first time that program is being reauthorized after COVID. So it'll be interesting to see if that changes things. COVID has sort of politicized pandemic preparedness and public health. And so how does that affect the conversation there? Don't count out Congress this year. A lot of people, like we talked about at the beginning, have said, oh, nothing's going to get done. There's so much gridlock. Whether things get over the finish line is definitely an open question, but there's still going to be a lot to talk about in healthcare in Congress this year.
for a Medicare negotiation. That's another big area that we're tracking here. That's going to be a huge bureaucratic undertaking. One of the difficulties is just hiring enough people at CMS. My understanding is that they're already starting to borrow from within the agency, especially CMMI, which is kind of interesting because CMMI obviously has its plate full too, as I just talked about with their demonstrations. But as far as how that's been going so far, I mean, CMS on September 1st is supposed to initially give the initial list of 10 drugs that it will negotiate. So that's a big thing to watch for. Probably the most consequential thing to watch for is how aggressively CMS negotiates prices once it actually starts negotiating prices. And that will take time to suss out, and it may shift over the years. That won't just, that could affect not just brand drug prices, but also things like like generic competition, whether biosimilars get developed. So I think on negotiation, it'll be a while before we really understand how impactful that is. You have two camps. One camp says nothing will get done this year, and the other camp says that divided government makes for compromises. It looks like they'll probably figure out a way to pay less for accelerated approval drugs until they get confirmed. Congressional Medicare advisors, I'm talking about MedPAC here, they have proposed in the past making drug companies pay rebates back to Medicare on accelerated approval drugs. That was the way that MedPAC thought it could be, just done, because the CMS has, I don't understand this, but they have systems, and they you can't just say, okay, we're going to pay less for these drugs. You have to figure out how to do that. So it would be operationalized in that way. At least that was how MedPAC suggested doing it. Yesterday, when HHS officials announced this, they made it clear that there's a lot to work out here, and that's just one option among many that they're going to be considering. September 1st, again, will be the date for the first list of 10 drugs that they're going to negotiate. So that's the big next thing. And there will be a lot of, guidelines and so forth that are published throughout next year as they, figure out how they're going to do this.